My name's Victoria Power. I'm a trainee advanced clinical practitioner for gynaecology at Rotherham Hospital. A miscarriage is the loss of a pregnancy, either early, which is classed as before 12 weeks of pregnancy, or late, between 12 and 24 weeks. As an early pregnancy assessment unit, we deal with any miscarriages up to 19 weeks and 6 days. Knowing you've had a miscarriage is very difficult, and the symptoms can vary quite a lot. Lots of ladies may experience abdominal pain, vaginal bleeding, or loss of pregnancy symptoms. All of these symptoms could be included, or you may have one or two. There are several different types of miscarriage. A silent miscarriage or missed miscarriage. This is when on a scan a pregnancy is still in the womb but unfortunately no heartbeats are seen. An incomplete miscarriage. This happens when part of the pregnancy, placental tissue, is left inside the womb when somebody has already passed, often referred to as retained products of conception. A complete miscarriage. This is when a patient has had a scan that's shown a pregnancy previously and a follow-up scan shows no pregnancy in the womb. Unfortunately, 1 in 4 pregnancies end in a miscarriage, and often we don't have answers for why this happens. This is sometimes very difficult for people to understand. The emotions that you'll be going through after having a miscarriage can vary a lot. Yourself and your partner will feel mixed emotions. There's no right or wrong way of dealing with the miscarriage. We can offer support if you need it in the form of counselling. You can always ring the department if you need anything. Once you've been told that you've had a miscarriage, the options that are available to you will be discussed to you by the nurse or midwife that's seen you in the early pregnancy assessment unit. They're not always appropriate for everybody, but some of the options will be expectant management, which is where we allow your body to do what it would do naturally, and we wait and let the body take whatever path it needs to. There's a medical management where we give you medications that will just encourage the process that would happen naturally, or a surgical management where we can perform a procedure either under a general anaesthetic where you put to sleep, or a local anaesthetic when you're still awake. After a miscarriage, it's a very emotional time. There isn't anything different that you would need to do if you do become pregnant again. You'll be advised of this at your appointment. Normally, we just tell you to go about things as you would do with any other pregnancy, and ring us if you have any concerns. Lots of ladies go on to have normal, healthy pregnancies after a miscarriage. Just because you've had one miscarriage doesn't automatically mean that you're always going to have any problems. If you feel as though you're having a miscarriage, if you have any concerns at all, you can always ring the early pregnancy assessment unit. If they're ever closed, Ward B11, the gynaecology ward, is always available out of hours. So if you have any problems at all, always ring somebody. If it's an emergency and you're bleeding very heavily or you're in a lot of pain, then please attend UECC as an emergency. If you're ever unable to get through to early pregnancy or Ward B11 and you don't feel it's an emergency that requires attendance to UECC, you can try speaking to your GP or your community midwife.